Welcome back. Cooperative Governance and Traditional Affairs Portfolio Committee Chairperson Dr Zweli Mkhize is concerned over continuous initiate deaths in the Eastern Cape. Mkhize and his team spent days in the province and visited areas in the OR Tambo and Alfred Nzo districts. He joins us now via video link to have a discussion about this. Dr Mkhize, thank you so much for your time and for you joining us this afternoon. We truly appreciate it. Now, the initiation summer season is nearing an end as we see initiates making their way back home. But what has been the CoGTA Portfolio Committee's assessment of this entire season?
Well, thank you very much. The assessment of the Portfolio Committee is that the deaths that have occurred remain deaths that can be prevented and that are necessary, but that over the past few years there's been a slight improvement in the regions in the Eastern Cape, which is mostly affected by this. And so there are three groups of causes of death that we have found. Firstly, it's causes that are linked to dehydration. The second group are causes that are linked to sepsis or infection. The third group are diseases that could have been pre-existing or unrelated to the conduct of the initiation custom. Now, if you look at all of these three, it basically means that there's a lot of coordination and a lot of education that is needed so that we can prevent the causes of death. Most of the initiates tend to get restriction of water intake before the initiation, and that information is slowly getting through to the community to say it is not necessary for that restriction, but you need a huge, massive communication so that those who know this and the older people and the leaders and the professionals can reach out to a lot of youngsters and initiates so that they can understand why it's important to take a lot of fluids. The second one is that the issues of sepsis is linked to the operation itself. That means that we need to have an understanding that if there's a complication during the custom, then people should be able to be taken to hospital. There shouldn't be so much of fear or taboo or concerns that people should actually finish the whole initiation without getting rescued to be hauled to the hospital. The third one relates to the need for pre-medical screening, where people must all go to the initiation through the assessment by doctors. Now, a lot of them are going through this, but sometimes we find that there are those who are not able to comply with it. So what we have, when we met with the teams that are involved, Amakosi, provincial, district house, and local municipalities, communities, and professionals from various departments. They are very committed to try to deal with this problem. But we realize that we need a lot more resources. We need vehicles. We need more people. We need a campaign that runs for a long time, so that some of this information should just be general information from for the initiates to understand that these are the things that are important to save the lives. So we are concerned about the deaths. When we were there last week, the death numbers were up to 12. Now the number has gone up. And so this is something that we believe needs to have the alignment and coordination of all the leadership. That doesn't just become a government, but also traditional leaders, because the work of the initiation is done by families. So, if there was not enough information to that family or from that family, then the authorities end up not knowing or having all the information that is needed. So communities at individual levels, at family levels, at relatives levels need to participate so that we can also deal with those who are negligent and deal with those who break the law in the way they go about with a custom which everyone accepts. It's an age-old custom that has to be supported, but it does not have to result in deaths. As the slogan of the province says, Mabaye Pile, they must go there alive and come back alive. So we need to keep essence of trying to support the province on this matter.
And speaking of that support for the province, Dr. Mkhize, I mean, is there any cross-pollination of strategies amongst provinces themselves? Because you see provinces such as Mpumalanga and Limpopo who don't have such alarming rates of deaths amongst initiatives. Are there any strategies that are shared amongst provinces, especially for the Eastern Cape, to be able to improve on their numbers?
It's got to do with the institutional memory of the senior members of society who have to take charge and conduct oversight over this matter. So, for example, in the Eastern Cape, it's not the whole of Eastern Cape that's got the same fatality numbers. It's been mostly the OR Tambo and Alfred Nzo. Now, they can explain that, if you look at the history, there was a time when the custom was not conducted in the same way. So it's something that you have to build on over a long period. In terms of cross-pollination, yes, there are things that are getting to be standardized. For example, the issue of the coordination across traditional leaders, municipalities, and all level of government, involvement of departments, that has come up quite strongly now. The second one relates to the pre-medical screening to make sure that that can be done everywhere. That actually is also being done across all provinces. The third one is enforcement. In the event that there are deaths or any sort of negligence, that there is actually consequence management. That again is being done as well right across. So there is a lot of things that are more or less standardized now, which is very, very encouraging because it has brought about an increased number of prosecutions and convictions. But ultimately, the issue of consequence management relates to the fact that it's a family that takes a decision to select the customary surgeon and nurse, and therefore whatever happens sometimes does involve the family. So to apportion any sense of culpability becomes very difficult in a situation like that. But what we think is important is to bring more resources so that the authorities are able to visit as many of these initiation schools as possible, because it's only then that they're able to intervene, to guide, to rescue, to impact on the practitioners and even the initiates so that they can do certain things. If they can reach to them, then it actually helps. But in some instances, it's very difficult to reach because not all of them are reported, not all of them are in accessible areas, and unless it has been reported, it may go on without anybody knowing that there was an initiation process going on there. So we need to then empower the traditional leaders to take an audit in each area as to where these would have been taking place. So it actually needs a lot of work that needs to be done, taking the community along, because everybody knows about the custom, but they need to know about the safety measures that are important to bring in to reduce the deaths.
Most certainly it is up to the entire community and not just up to government or the initiation schools themselves in order to ensure. I mean, you speak about education, awareness and constant communication with communities. Maybe just talk to us about the existing regulations that govern traditional circumcision practices in South Africa. And are they sufficient to ensure the safety of initiates, given the number of bogus schools that we see popping up from time to time?
Actually, that was the reason why we went on an oversight visit, because we wanted to know, here is a law, it's been put in place, is our communities complying with it? Well, the law has got a number of things in it. The first one of the things that is to focus on the coordination structures. Now, that means traditional leaders, government departments, all of them need to be coordinated so that on the ground, in every district, there's a team that's overseeing this whole process of initiation. Secondly, that in every traditional area, Inkosi must have their own, forum where they discuss these issues, which involve the leaders and the operating surgeons, as well as the parents and so on. Now, this again is happening. Now, where they thought there was a gap was that sometimes what is happening in the area under Inkosi and what is being done by the municipal and government teams that are coordinating are not always aligned. And now when we check what's the problem, we realize that there is the defect in the law that has restricted the participation of traditional leaders in municipalities. Now, those who are not participating directly because of the law are not easy to coordinate, because then they're not regularly part of the municipality. Now, that's an issue that we thought we need to go and deal with. The second aspect also in the law relates to the the pre-screening, the medical screening. Now, everywhere, if there's an initiation school that is in place and the initiates don't have a medical screening report, then of course it's illegal. Now, what we found is that in some instances, people can still do without the screening. In some instances, there's a collusion where someone who is healthy gets a health screening that is saying that he's okay, he's healthy, and then they swap it and give it to someone else, and therefore you discover afterwards that in fact it was not the same person that couldn't check. Then you find that some of the initiates come from other provinces and are going back to a home province, and then they come in there with what might appear to be unsatisfactory reports, but they come from somewhere else, so it becomes a bit of a challenge to ensure authenticity of those kinds of certificates. Then the other area is going to do with the fact that in the olden days, the initiation school had to be kept secretly and therefore far away from community. Now, the law is saying they need to be within accessible areas. And the reason for that is very simple, is to just ensure that if there's an accident, then somebody can actually go and get assistance quickly. Now, just to give you an example, so we go to visit this particular area, this one Boma. We drive from the city, from the town, maybe say 40 minutes we're driving, and then we get onto a gravel road from off the tar road for about 15 minutes on the tar road. Then after that, you go on a place where you must go use 4-bike. Then you go for about 4 or 5 kilometers. Then you must walk on foot in a very rugged territory. So if there was an accident down there, to get assistance would take a long time. So, for example, there is one person who got burnt in a Boma. So it's an accident that if it was not so inaccessible, something like that could have been prevented. So if an unrelated issue could crop up. So these issues are all within the law now. So we are satisfied that the law covers everything that needs to be covered. What we need is adequate implementation, monitoring, resources, so that they can all be supervised properly.
Lastly, Dr. Mkhize, how can the national conversation around traditional practices and their modernization be improved in order to ensure that both cultural respect and the health and safety aspect of participants is adhered to?
It needs to be started at community level. The communities must first be willing to participate in the conversation on this basis that we are respecting the custom, but we are preventing the deaths. It's very, very important to start from that level. But when I discussed with a number of people, I found, for example, the police, I found the doctors, all of whom had gone through the same custom. They say that, there's a lot of peer information sharing that, is informal. So what we need is to get the people who are influencers at that level, engage them in the conversation so that we can all be together in terms of what discussion. But it's going to take a while because a lot of the information that causes accidents is a word-of-mouth issue. Everyone can tell you that you need to provide water, you must have water, you must drink water, and so on. So one policeman was saying to us, we explain all of these things, and the initiates, they understand it, they say, fine, we understand you. But when their peers come and then they discuss them with them on the basis of peers and their experience, then of course it tends to take a different direction. So you need to impact at that level. But one thing that everyone is sensitive about, it cannot be done as an imposition where government is imposing this and outsiders are imposing that and so on. It needs to be understood that the practitioners, the owners, of the custom need to start the conversation and be supported to spread, because there are already lots of people who are really willing to actually help spread, but it takes a long time. We need more resources. They were saying to me, we need a campaign outside the initiation period. So the campaign must start from the beginning of the year to the end of the year. Not 1 year, not 2 years, many years. And we must target changing generations of youngsters who are coming up, and also focus on the initiates who have come out and those who are going into. So all of this discussion require that we must really be supportive more than any other thing. But of course, where we can prove transgression, there must be action so people can see that this is not acceptable. But at the same time, it should not be like the outsiders who are coming to take over the custom. You will not succeed that way. But if you sit down and work through, then it becomes much easier. For example, if you're talking about Izinkosi, if you gave Izinkosi, human resources and vehicles, and ask them to say, look, in your area, just make sure that everyone who goes through this initiation reports. Then, of course, you'll actually improve that.
All right,
the reporting will be...
would certainly be more efficient. Thank you so much for that. It certainly is an ongoing conversation, like you say, in order for even more generations to come to be able to enjoy these cultural practices. That's Dr. Mkhize, who is the CoGTA portfolio chairperson, speaking to us about the concerns over the deaths